All right, we are good to go. Thanks for joining us, everyone, on Facebook and on Zoom. My name is Krista Gervon. I'm the Communications Director at Princeton Integrative Health, and I am joined today by Joe Bonacci, our acupuncturist. And we're talking about stress because April is Stress Awareness Month, so I thought it'd be great for Joe to join me today to talk about how acupuncture and some specific specialized acupuncture that he's going to go into a little bit more can really help with muscle tension and stress. So I'm going to let Joe introduce himself before we get into our discussion. So Joe, you want to give you a little intro of yourself?
Yeah, thanks, Krista.
Sure.
So my name is Joe Bonacci. I'm local to the area. I grew up in Titusville, New Jersey. Went through Hopewell High School. I went to Carnegie Mellon before I ended up in acupuncture school. Was working with Princeton Sports and Family Medicine originally. Dr. L.Ac, who's over there, was my family doctor growing up. So I had a great opportunity to start working with sports medicine and pain management right out of school. And specifically with trigger point dry needling that we'll get into for sports medicine and stress. And yeah, just kind of grew my practice from there and got really interested in functional medicine after I'd been in acupuncture for a while. I had some patients that weren't getting better and had complicated cases, and I wanted to learn more about them. And that's why I joined Princeton Integrative Health, and it's been a really great journey in terms of learning more about that and being able to help patients more. So yeah, it's been kind of my journey. I've been practicing acupuncture for 11 years now.
Nice. Yeah, you joined our practice a little bit before COVID hit. So it's been definitely an exciting and interesting time for sure.
Yeah.
But thank you so much for speaking with me today about this topic. It's so important because there is so much stress in our life in a normal time. And of course, with the pandemic, there's a heightened amount of stress in our life too. And we've been talking about stress all month with different topics. So I talked to Jenna about nutrition and how it can help us, retain more weight, and Dr. Vinny about how it impacts our brain. So I wanted to just talk to you because this is something we really haven't covered at all. But how does stress affect our muscular system?
Yeah, so a large part of why I think acupuncture is really effective as a therapy is that it doesn't just address the physiological aspect of stress, it simultaneously addresses the mental aspect of it. Essentially what we find most commonly in acupuncture is people come in and they say, I have neck tension. And it's like, okay, so where's that coming from? And usually it's related to daily activity or some kind of acute event. So if it's an acute event, it was maybe a car accident, say, where they got whiplash. Usually there's some stress involved in that, right? There's a trauma that happened to put them into a fight or flight setting in their nervous system. And essentially the neck tension that they have from that acute event isn't just muscular tension. They essentially are also keeping some mental stress in that tissue. The nervous system activated in that moment, and it really made the muscles tight. And essentially that kind of learned behavior is still in the tissue inherently.
Wow.
Other people, they're working on a computer all day or they're driving a lot. You're working your job and you're having some relative stress from work, deadlines and things like that. And at the same time, your hands are on your computer and your shoulders are up the entire time. So you're essentially just throwing all the stress into that part of your body. It's just inherent in the fact that you're in a stressful state while also having a physical activity that's putting some stress in the tissue. So those two combine and it creates chronic stress that doesn't go away, doesn't relax after you leave the computer and after the stress event stops. With acupuncture, essentially, what they've noticed under functional MRIs and how they're kind of reverse engineering acupuncture is they're noticing different brain activity while people have treatment. And they almost consider these quote unquote side effects, even though they're positive. They call them side effects because they happen whether the acupuncturist is treating the person for anxiety or whether they're treating a sprained ankle, they still get these responses. That's why they call it that way. Essentially, there's two mechanisms that they notice. One is that people automatically switch from more of the fight or flight setting in the nervous system to the rested state. So this is kind of the relaxation response that's associated with acupuncture. And also the other part of the brain that becomes really active is something they loosely call the limbic system, which is really the older part of our brain.
Right.
Some people refer to it now as like the reptilian brain. What it is, it's all the involuntary systems we had before we developed higher brain functioning. So it's basically, when melatonin releases for sleep, when digestive enzymes release for digestion, controls a lot of your cortisol response for stress. From the Western standpoint, they're looking at that and they're like, oh, there's some kind of homeostatic response that's going on in that part of the body, which is how they explain why some people's thyroid levels, start to level out when they get acupuncture for a year for neck pain. Why did that happen? Clinically over 11 years, you see this stuff happen, and it's really interesting. From my perspective, I think everybody has a certain level of response, just like with any therapy. So some people have a really high systemic response physiologically to that aspect of, kind of changing and benefiting involuntary systems, and some people have a very small amount of that. They all get the physiological benefit of the acupuncture otherwise. But yeah, so a big part of stress is really kind of what you're doing during the stressful moment, how often you're triggering that. A part of that is also you're engaging the fight or flight aspect of your nervous system. And normally when we were supposed to do that, kind of in our lineage of being humans, that was to run away from an actual stressor, the whole lion, tiger, bear, scenario people talk about. Except, if you're looking at your mortgage statement and wondering how you're going to pay it next month, and you're, again, sitting at the computer with your arms up, your nervous system's engaging in fight or flight, but you're not going anywhere. You're sitting in your chair. So again, like the reason that your shoulders get tight is because in that moment you happen to be engaging them more than you should be. And so the fight or flight mechanism is looking to activate something, and so it activates that.
Right.
You're sitting in a chair instead of running, so it's got to do something. And again, just, kind of normal stress issues. People trigger their stress response too much. Instead of using it for running from a tiger or bear, they're using it because they're late for lunch. And so we just get into these patterns where we're chronically firing these issues and chronically creating stress. And yeah, usually what I notice with patients is, they're like, I was able to handle this in my 30s and it would just kind of go away. And it was only like a 1 out of 2 out of 10 for pain. And then, eventually there's some kind of stress event, or they just get a little bit older and their body doesn't adapt as well. And then all of a sudden they're really getting pain, they're really getting referral pain. And that's when they kind of come in to see you as a patient. So that was a long-winded answer, but that's...
No, it was so great. Levels and layers to it all, and I really appreciate just the amount of information I think that you bestowed upon us. So thank you for just all of that.
No
and I think you even kind of touched on this a little bit, but after, over time, all of those types of stress that affect our muscles and things like that, how does that end up, affecting our overall health and quality of life? Like I think you did touch upon it a little bit, but if you could elaborate a little bit.
Yeah, so it gets really interesting when you start talking about that topic. What does a tight muscle actually do to the body? So, from a physiological standpoint, whenever a muscle gets tight, there's less perfusion of blood. So they're not circulating as much blood through the area. In Chinese medicine, that's really important because, a little bit different than Western medicine, there's a lot of actions that the blood can have on the tissue itself that make us really want to make sure that there's some flow going through there. From a more Western standard point, it can impinge a nerve. So a tight muscle can lock down a nerve. Every acupuncturist that does trigger point needling, their favorite patient is a piriformis syndrome patient. Essentially, these are people that have what they think is sciatic pain. But for the piriformis muscle, basically runs from the front of your sacrum through the SI joint and attaches on your hip. And about 30% of the population, the sciatic nerve that runs down through there actually runs through the fibers of the muscle itself. Everybody else is underneath. Either way, if that muscle gets tight, it'll impinge that nerve and give you really severe nerve pain down your leg. And often we'll have cases in acupuncture where people will go to an orthopedist with that pain. The orthopedist says, hey, let's get an MRI, see what's going on. They look at their low back. They happen to have some kind of disc issue in their lumbar. 60% of us do if you test the random population, even people without symptoms. So they'll be like, okay, it's coming from your lumbar. You got this disc issue, and they'll either do physical therapy, which might not work necessarily, and then they'll end up doing surgery. And they expect the surgery to correct it, except they come out of surgery and they still have pain. Again, the whole issue is that the origin of the pain is this tight muscle that's pressing on the nerve, and no one's addressed it because it's in a different area of the body than where they're looking. So they go to see an acupuncturist who does trigger point needling. You release that muscle, and all the pain goes away instantaneously. And that patient then tells everybody with low back pain and sciatica that you can fix them in one treatment, even though that's not the case, and you get a lot of business out of it. But yeah, that's one example of how just muscular tension from stress basically can give you a larger issue. Another factor on that is, tight muscles in the neck can impinge the blood flow to the brain. And while a Western doctor might test that and say, that's within range, it's not a big deal. We worry about longevity and how things add up over time. And yeah, if you have a lot of tight neck muscles running through here, you're not going to get as much blood to your brain. And that, as we know, that can lead to cognitive decline. and a whole host of other issues that go on with that. So yeah, the muscular tension is a big issue in terms of what else it can do long term. Another interesting fact, so a big part of acupuncture is that we work with fascia. Most people don't really understand what that is. Fascia is the connective tissue that runs between your outer skin layer and all your muscles and organs. It's basically like a big spider web network of tissue. Western medicine used to think that that was kind of just a structural element that wasn't that important. It's kind of the thing you got to cut away to get to the more important stuff. Recent studies in imaging technology have actually discovered that that tissue actually carries signals, electrical signals, carries fluid that's related to immune health. Not exactly like lymphatic tissue, but similar. And they're starting to realize that it's a communication network that's actually doing a lot for the body. And so that's a big part of how they're trying to reverse engineer acupuncture. They're starting to realize that, okay, so that point for the stomach on the foot is actually connected to connective tissue that runs to the actual organ. And when they stimulate that point, it creates a downregulation of inflammatory markers that are normally inherent to the stomach. And so they're actually starting to realize these different complicated mechanisms that acupuncture has different explanations for. The reason I also brought it up is that fascia is now being understood to be really highly associated with proprioception. Proprioception is your ability to know where you are in space. So when I put my hand up in the air, I kind of know relatively how far it is, from my base and from the wall and all that. So in terms of like, say, orthopedic injury, they used to really think that, all right, you sprain your ankle, you're 80% more likely to sprain it again. It's just because the ankle's weak, the tissue got stretched and it's not really doing its job. Part of the new understanding is that actually what happened, as a complication of that is that the fascia was injured during that sprained ankle. Going to run into another topic here of the Rice method and ice. So they're also running into the fact that chronically icing things for acute injuries leads to chronic injuries later on, or a higher percentage of them. And part of that is because the ice actually numbs the fascia and makes it less aware of itself. So you saw basically like the reason people are getting multiple sprained ankles is that the tissue itself is not doing its job, the fascia, and so it's not intelligent enough to tell the brain where the foot is. So when you step off the curb, you're more likely to step wrong and sprain your ankle again than you were when it was healthy. So there's a lot that goes on with tissue health. If you have a lot of tight muscles and a lot of stress, you're actually not even really aware of your body in the room that you're sitting in as well as you could be. Which can lead to a whole bunch of other, mental health issues in terms of, how you feel in the world and how comfortable you are in the chair you're sitting in the room of the people you're in. There's a lot of cascading effects that can go along with that, honestly are things people don't even realize that when you treat them, they feel better and they don't even really understand what that is. They're just like, I feel better. I feel more like myself. I feel more grounded in the world. And that's kind of where you get into these explanations from patients where they don't really understand the change that's happening, but the acupuncturist is kind of like, no, I can see that, from what we did. So yeah, it gets pretty deep in terms of how tight muscles can affect, the rest of your world.
That is fascinating, and I did not know that, but it makes so much sense. And when you talked about how it can start affecting your mental health, it's so sad because when you're not as aware of your body or secure in it, that does totally affect your mental health. And I think a lot of people are struggling and probably don't even realize it.
Yeah.
So thank you again. You did mention the trigger point dry needling, which I did want to really get into a lot because I know that that's a specialized technique that you use. So if you could tell us how that can really help and how, I'd love that. Thank you.
Yeah. So, we got this issue that there's tight muscles, right? How do we fix that? So this is a trigger point dry needling. It's a very interesting topic in acupuncture right now, especially in New Jersey. So essentially trigger point dry needling is a term that kind of came out through Western medicine, although the technique's been around for thousands of years in Eastern medicine. In fact, the technique was originally called sparrow pecking. It was a type of way of needling. And it's literally because the needle technique is like a sparrow pecking at the ground. It's like this uneven approach. And I'll explain why that is. So essentially trigger point is just a fancy word for a knot in the muscle. Say we're talking about the upper trapezius that runs from your neck to your shoulder. It's like one of the most common tight muscles people have. It should be elongated and relaxed and smooth, and able to fire and relax as it's supposed to with, what it needs to do structurally. Generally what happens, usually through head forward syndrome, so your head's kind of leaning forward, it puts too much stress on your neck because it's taking away the way the weight's distributed through the structure of your spine.
Hmm.
So it puts a lot of tension on the muscle and it gets tight. Trigger points usually occur either at the beginning, the origin, or the insertion, or right in the middle. It's just the most common, the way the muscle twists and gets tight. So yeah, you get this tight, twisted muscle. Again, that can occur from an acute injury or chronic stress. And essentially, that muscle is also connected to this fascia system that's encircling it. And so what you can develop is what they call trigger point referral patterns, which become confusing for people that aren't aware of them. So the muscle in your neck, it actually has its own, origin up into the back of your head here. So, if there's stress in this muscle, it can land up here and people are like, oh, I got some tension here. What they don't realize is that that's also connected to the fascia that wraps over the head to the eyebrow. So it'll start here, move to here, and then it'll climb up to the top of their head, and then eventually they're getting frontal headaches. But they don't feel the whole trajectory a lot of times. And they might even start with the frontal headache. So a patient will come in and say, I've got frontal headaches, and then you start treating their neck, and they're kind of confused as to why you're doing that. But yeah, it's just basically all related to this pulling action that creates this tension headache, as we call it. So yeah, essentially with trigger point needling, what we're doing is we got to get rid of this muscle knot, and that's a learned behavior essentially. The same way that throwing a baseball repeatedly lets your body develop muscle memory so that you know how to do this action. This is just a negative form of that essentially. So what trigger point dry needling is, all I'm doing is basically holding the muscle so it can't run away from me. So I'm holding it in place. What's super interesting is I don't actually have to touch the muscle to get the muscle to release. So basically this muscle is tight and twisted. The fascia around that encases it is also tight and twisted. And that's really where I'm interacting with it.
Okay.
Essentially the muscle has stress on it. So it has this action potential. It wants to get rid of the stress. It doesn't really want to hold on to it, but it can't do it on its own. So it needs a little bit of a stimulus to create a reaction that releases the stress. So what I do is I hold the muscle and I tap unevenly around the tension in the muscle. And what the muscle does is it reacts, and it feels a little bit weird for patients. It can be a little bit surprising. Essentially, the sensation is like flexing your bicep, except I'm doing it for you, and it's a muscle in your neck. So normally you're used to having, voluntary control of your own muscles, and you're laying there relaxed on the table, and somebody else is manipulating. It's a little bit weird for some people to feel like their body can be manipulated that way externally. And so it's doing this action of jumping. They call it fasciculation. So what it's actually doing is like a rope with a knot in it. It can't unravel the way that it raveled up over time. So in order to unravel the knot in the rope, it has to come together to create slack in the knot and then jump back out. So what the patient feels is this, fasciculation, this jumping action. But what's actually happening is the muscle is instantaneously coming together to create slack and then jumping back out. And when it jumps back out, it actually unravels and elongates. So it's a little bit of a more intensive therapy. Most acupuncturists that aren't trained in trigger point needling, they have a longer approach to releasing the muscle tension. Generally, what they're going to do is they just line the muscle with a few needles. And everywhere where you put a needle in the body overreacts. It creates a reaction in the immune system that's positive. It increases circulation and releases anti-inflammatory cells. So the acupuncture needle is super thin. It doesn't actually damage the tissue. We're basically able to enter the body, prod your body to have this response that's positive, and then remove the needle. So that technique works. It just takes a lot longer.
Okay.
Having grown up in New Jersey as an athlete, working with people that don't know anything about Chinese medicine, that think it's a little bit, out there, I wanted to develop a technique that was really, people can see how it works. They know how it works on the table. You can explain it to them and they can feel results faster. So that's really, the most effective approach I found for it. It's just quicker.
Okay.
So yeah, essentially what we're doing is we're releasing that muscle. We're teaching it to basically be relaxed when it's been taught to be tight. So the response that happens after treatment, you'll feel some soreness in that area. And that's not from any trauma from the needle, like I said. It's literally just lactic acid releasing from the muscle. So normally you go to the gym, you engage your muscle, and then it lets go, you get lactic acid.
Yeah.
Well, this muscle's been working out and hasn't let go in a long time. So I force it to let go, force it to release, and then it releases the lactic acid. For the first 12 hours after treatment, you feel a little bit more loose in your neck, but it'll feel like I've kind of pulled things apart and that there's a lot of this soreness circulating. So the best people feel is the next day. They drink a bunch of water, put some heat on it, circulate the lactic acid the same way you might after a gym workout. You wake up the next morning and the tissue's had a chance to kind of reorient itself, and you wake up and you're in less pain and you've got more range of motion. And then usually the pattern is that that will start to slowly creep back into tension because the muscles have been taught to be that way for a while. Usually there's some kind of daily stimulus you're still doing that's also causing it, which we have to also coach you on working out of. But yeah, generally the way it works is after about 3 or 4 treatments, the muscles actually learn to be relaxed. And what I most often see is people who came in with a 10 out of 10 pain and headaches all day. They're now in a state where they're like, well, there's some tension there, and I get a headache, once a month, but like it's all extremely manageable. None of it's in the forethought of my head. It's not changing my lifestyle. I'm not making decisions around it. And then it's just about how do you get rid of the last 10%. And a lot of that's usually lifestyle. They have to fix how they're working on the computer. They have to, manage their life in a way. And sometimes they can't, they're carrying a kid all day in their arm and their shoulders are always going to be high. Then I become their regular therapy to avoid having to take internal medication that gives them other side effects or, more severe therapies that aren't as holistic, that aren't going to give them less side effects the way I do. So they become your regulars, quote unquote, in terms of people that can't stop doing the action that's causing some of the tension.
Right. That makes total sense. I was actually going to ask you how often would people need to come in for that? So that kind of answers that question too. It's
Yeah,
obvious.
usually I see people about once a week and usually 3 or 4 treatments, and we have a really good idea at that point of how much it's affecting them, how much more they might need, or how much less.
Right.
And a lot of people, honestly, they just find how it works for them. They understand the therapy, they understand the sensation they get from it, and the relief they get from it, and then they just basically put you in their back pocket as, okay, so now I know if I have something that creeps up like that, I can go see this guy instead of having to go to sit in an office for a 15-minute appointment where I get an MRI or an X-ray, and then I have to go to the next step. And it's a whole process. So if they feel like they can come in and get some hands-on therapy immediately that treats it, then they're much more willing to skip, these other type of processes that might be unnecessary for that issue.
Yeah, absolutely. And how did you decide to even incorporate that specialized type of treatment into your broader practice?
Yeah, I mean, essentially, it was part of my decision of where to go to acupuncture school.
Okay.
So majority of acupuncturists are only trained in TCM, traditional Chinese medicine. It's kind of the standard that we all run off of. It's what all the national tests are based on.
Right.
But traditionally, acupuncture was never standardized. Acupuncture was a cultural development that had family lineages that had very specific, treatment styles. The reason acupuncture allows for that is essentially there's a map of how to use points to affect the body. And there's different styles of how to engage that. There's a lot of ways to do it. And certain methods are better for certain conditions. Even certain methods are more effective for constitutions in different parts of the world. If you're treating a lot in the Northeast of the United States, you're treating a lot of stress issues. You're treating a lot of liver, stomach dysfunction that results from essentially mental stress. If you're working in, Southeast Asia with people that live off the land, you're not going to be dealing with those issues. You're going to be dealing with different types of issues, and meaning like you might have similar conditions, but the constitution of the person is completely different. And so, yeah, traditionally, TCM wasn't really standardized. It wasn't until they had the Cultural Revolution in China, and they were trying to figure out whether they should get rid of Eastern medicine entirely and only adopt Western medicine, that they really decided that, no, there's something here, like this Eastern medicine is really effective, but they tried to standardize it and consolidate it. Honestly, that's in part of the history of acupuncture. That's when a lot of people came to the U.S. Because at that point in China, it was illegal to practice your family's lineage. You had to practice standardized TCM that they decided on. So you had a whole bunch of people enter California from Asia that were practitioners that were basically practicing illegally in the 60s and 70s. And a lot of my teachers were kind of rebels because they were learning from those people and starting practices. And it was just before it was regulated by, the Western system. But yeah, a big part of what had me incorporate that in my practice was deciding to go to a school that taught multiple styles. So we learned TCM, we learned Kiko Matsumoto Japanese lineage, which is a pretty famous Japanese practitioner, has her own style. As I say, a lot of TCM is kind of learning how to drive on 95 to get somewhere. You start practicing these lineages, it's like, nah, there's a bunch of side roads you can use to get around things, but they're really complicated and you have to know exactly how they work because they're very specific to certain conditions and certain styles. TCM is more generalized. The style that I practice the most right now is actually APM, acupuncture physical medicine. It's not very well known in general unless you're an acupuncturist. Essentially, Dr. Mark Seam, who was the president of the school that I went to, developed the style. It's a mix of TCM and the trigger point therapy needling.
Mm-hmm.
A lot of it's based on studies by Dr. Janet Travell. She was basically the Western doctor in the 50s and 60s that really dived into trigger points. She put it in the Western literature. She literally went through every single muscle in the body, identified where the tension can be found and where the referral points are. She would press on the trigger point and then ask them where they felt it, and she put a red dot on a chart where they felt it. And then you do that to a few hundred people, and there's a solid red area. And it's like, okay, that's like where the most common referral from this muscle is. Yeah, and what was interesting about her approach was that she tried 3 different styles of injection therapy for trigger points. So she was using a hypodermic needle instead of an acupuncture needle. And she used it 3 different ways. One was with lidocaine, one was with saline, so benign salt solution, and the other one was empty, so dry needling, where she's just using the needle as a tool. And in her text, it directly says that neither of those three methods mattered. So it didn't matter if she injected lidocaine or saline. All that matters is that she got the fasciculation action to happen from the actual dry needle, from the actual hypodermic needle. So Dr. Mark Seam basically looked at all this literature, looked at the Chinese medicine, classical literature, and started combining things. And he wrote a whole bunch of books that basically made it very clear how to do this, and basically mixed a lot of TCM theory with Western biological medicine. So yeah, basically, unless you went to the school that I went to, I got 3 years of training in trigger point needling, so like 3,500 hours essentially. Any other acupuncturist that didn't go to my school was only able to access that information through weekend courses that people teach. So you go 9 to 5, Saturday, Sunday, you learn the needle technique, and then you hope to basically practice it enough with confidence in your own practice to develop it. Whereas I was able to kind of get the handheld version where I was able to get direct training for it. So yeah, the other thing that you learn in acupuncture school pretty quickly is that they say 60% of the people that come to see you come for pain management. So I thought it was a good idea to learn how to treat pain. So that honestly is the real reason that I went right into, trigger points. I was a college athlete for soccer. That's a big part of my background. So yeah, I really was interested in sports medicine and pain management, and trigger point needling since it was, really obvious in terms of a great approach to treatment. And like I said, it's obvious to people the sensation that they feel on the table, takes away some of the mystery of treatment, gives them a more palpable understanding of what acupuncture is doing for them. So it requires less verbal coaching in terms of trying to make people stay in the treatment room so they get the benefit eventually. This happens much faster. It's a little bit more of an acute reaction, so that they're more aware and they tend to understand it better.
Well, Joe, all this information.
Yeah,
Have a bit
these
of
are things we regularly say in the treatment room. We're just getting them on Facebook Live now, so.
Yeah, okay, so thank you so much. I'm going to check on Facebook to see if there's any questions. We have a good group of people here on Zoom as well, so if anyone's on and has a question for Joe, please go ahead and either write it in the chat or you can unmute yourself and ask anything you might have to ask. Let me just check on Facebook here.
Mm-hmm.
I feel like we should do more of these, Joe. This is really informative.
Yeah, again, these are a lot of things I end up telling people in the treatment room a lot. We just haven't really put them out in a public forum. So yeah, it's good to get the information out there generally.
Yeah, and if anyone who is watching has experienced any of what Joe was talking about, you can call us at 609-512-1468 and schedule a complimentary discovery session with Joe. He's also a functional medicine practitioner, and he can, answer any questions you might have and give you recommendations on where, what the best next steps would be for your treatment program. So please feel free to give us a call and set that, schedule that with him or another practitioner of ours. But yeah, otherwise we don't have any other questions, but I really appreciate everything. I think I'm going to actually set up another appointment with you. I've got a lot of tension up here. So, to release that and
hi, I'm sorry.
Oh yeah.
Hi, Regina. Is this Regina?
No, it's Krista.
Oh, Krista. Hi, Sumatra. Hi. Yeah, I do have a question. I do apologize.
Sure.
Now I do have I believe it's nerve damage in my my elbow, my right elbow, or it could be a tight muscle. But my question is that is the nerve damage, is nerve pain different from
muscle pain?
Yeah, muscle pain. I'm sorry. Yes.
Mhm.
Because nerve, I mean, for me, I may have to get surgery for the nerve, but if it's muscle pain, it is something that I can work with through therapy. But I'm not sure. That's what I need to know. I'm sorry.
That's okay. So yeah, just generically, nerve pain in your elbow. So generally you got to look at the joints above and below to see if there's any kind of impingement going on or if there's anything going on from your neck. One of the advantages of acupuncture treatment is I don't have to be the most clever diagnostician. If I don't know if the nerve's being impinged by a neck muscle, a muscle in your shoulder as it outlets the nerve to your elbow, or if it's being directly impinged by something in the elbow. I don't have to know because I can just needle the entire chain and release everything along the way. It's one of the
Right.
nice things about acupuncture. We often keep people out of surgery. Essentially if they go through some testing and they get physical therapy and it doesn't work, that's usually the next step. But yeah, the nerve in the elbow can be an interesting topic. The ulnar nerve kind of slips through a groove in your elbow. And generally, if it's coming on the inside of your elbow, that nerve got inflamed. Usually it's from contact. So a lot of times it's having your elbow up on the desk when you're working is the most common. And then once it gets inflamed, it stops sitting in the groove very well. And it starts slipping left and right out of the groove. And as nerves get inflamed, they get bigger, so it doesn't sit in the groove very well. And then there's usually some kind of muscular tension that develops around that. So your muscles start to tighten up around this injured nerve to try and help what it's doing, trying to protect it from pain.
Yeah.
A lot of times we stop using it as much because, we get pain from it. So essentially what we're doing as an acupuncturist, we're working with the soft tissue, which includes nerves. And we're trying to identify how much restriction's happening in the muscle, in the connective tissue, the fascia, and how much is actually just going on at the nerve site. Having said all that, I basically will release all the muscles that could possibly be pressing around the nerve or keeping it out of the groove. And then you put a couple needles along the edge of the nerve. You don't actually touch it or set it off. But basically, like I said, everywhere I put in an acupuncture needle, your body overreacts like it's a trauma, even though it's not a trauma. It releases anti-inflammatory cells and increases circulation. So with nerves and tendons, they don't have great blood supply, which means they don't have a great healing supply. So part of what's happening when I do that is I'll release a lot of the tension in the area that might be causing the nerve to ride incorrectly in the groove and basically impinge it more. And then I put a couple needles along the nerve itself and get that anti-inflammatory effect to calm the nerve down so it gets smaller and sits back into the joint. Sometimes with nerve pain, we'll reach for electric stimulation. A lot of people are familiar with that as a TENS unit from a physical therapy where they put pads on. It tends to be more effective, I feel like, from acupuncture because we don't use pads, so it's not a diffuse surface level stimulation. The actual TENS unit for acupuncture, there's alligator clips that go on the end of the metal needle, and therefore the electricity travels directly down to the point at the end of the needle in a very specific spot. So we can really target directly where the inflammation is and get the electrical signal, which ramps up this anti-inflammatory effect to be exactly where it should be. As opposed to putting like big pads on that might not get to the depth of where the inflammation is and might not be as specific.
Exactly.
Yeah, so yeah, a lot of times, and it's very common that we have people come in. Honestly, a lot of it tends to be with low back, carpal tunnel, and elbow where they really want to go to surgery and it's not necessary. We find ways around it. And luckily, like I said, I started working with Dr. L.Ac originally. He's an orthopedist that's really anti-surgery, so I had a lot of experience of working with him and being able to basically, work hand in hand with an MD to get people out of that scenario. Because surgery is just like every other therapy, except it's more permanent. So, you go to a physical therapist and it doesn't work, okay. But if you go to surgery and it doesn't work, well, now you've got changes in your body that you can't reverse. And so it can be a great solution, but it could also be a really bad problem to have. So yeah, it's just not something we reach for unless we really need it. It's more extreme therapy. That helped answer your question, Sasha?
Okay, great. Wow, that was far and beyond, I tell you. So I need to talk to my doctor and Lisa, is it? Lisa?
Yes.
Yeah, our front desk, you know that.
Okay, so Lisa, I will reach out to Lisa for your contact information. But that sounds like you nipped everything in the bud. That's it. Yes, great. I appreciate it.
Yeah, thanks for asking the question.
Thank you.
Yeah.
So this is kind of a record. We're actually at our 2-minute until our Zoom stops because I only have the 40-minute version. So Thank you so much again for everyone who joined us today. Thank you so much, Joe, for all of that information. It was just so enlightening. I can't tell you. So I appreciate
Thanks,
you.
Krista.
And I
Thanks for the interview.
have another session with you when we speak about another topic and related to acupuncture. Tomorrow I'll be joined with Dr. Connie to talk about stress in chiropractic at 11. So you can find that on our Facebook page, and hope to see you all soon. Thank you again.
Thanks, Krista. Thanks,
Thank
everybody.
you. Bye, everyone.
Bye.